Let's turn to our next session, and I'd like to introduce our next speaker. Penn, as all of the work, all of this pandemic really began to advance, the University of Pennsylvania, while having years of experience in researching and studying coronavirus, actually set up a Center for the Research on Coronavirus and Other Emerging Pathogens. And as part of that, our Medical Device Center, which is run by Victoria Berenholz, was able and very interested in trying to accelerate some of the research and other support needed for the development of medical device technologies for this particular pandemic. So with that, I'd like to turn it over to Victoria Berenholz, who is our Executive Director for Penn HealthTech, and she's going to give you a brief update this morning around the rapid response from her seat for COVID-19. Victoria?
Thanks so much, Mark, and thank you to the PAC team for the opportunity to present. I'll just take a couple minutes here to speak to Penn HealthTech's Rapid Response Initiative for COVID-19. So launched in May of 2017, the objective of our center is to be a center of excellence across the University of Pennsylvania to support innovation in medical technology. And on March 20th, in just a little over a month ago, in response to the COVID-19 crisis, we launched what we call our rapid response teams to serve as a backup technical resource for Penn Medicine through our mission and partners to address these acute unmet needs that were resulting and that we've heard from earlier today through the AdvaMed and other presentations. So we launched an online portal to identify those needs and create teams. We've created 7 teams, but continue to receive unmet needs and ideas every day from the community. And I'll just quickly walk through some of the initiatives we're working on. So we've all heard through the news about PPE shortages and other challenges. So we've worked to rapidly deploy leveraging partners and maker spaces within our community, face shields within the health system, face masks. We're also looking at developing PAPR face shields, looking at re-sterilization processes and procedures based on best practices and CDC guidelines. We're also looking at supporting emergency ventilator responses, both looking at acquiring and building approved designs, multi-patient ventilation, adapters or emergency response options, as well as monitoring systems to keep any emergency response as safe as possible. In addition to this, we've helped support the deployment of point-of-care ultrasound to support rapid point-of-care diagnostics in the health system, as well as robotically controlled telemedicine carts to enable the scale of telemedicine and minimize provider COVID exposure. So that's just a very quick look at some of the technologies that we've deployed over the past 4 to 5 weeks to fill these acute supply chain gaps. Over the next period, as those gaps become filled, we're looking to continue to support innovation in the fight against COVID-19. So please join us by submitting your ideas. Our website is listed there. And ongoing, we'll look to continue to support the tremendous innovation coming out of the Penn community in the health technology space to battle COVID-19 and beyond. None of this would have been possible without a tremendous outpouring of support. We've had hundreds of Penn student, faculty, and staff volunteers over the past month, as well as countless community partners, many of whom are on the line today, supporting this both in terms of providing resources and facilities to support this rapid response initiative. So thank you.
Thank you, Victoria. Thank you, Dr. Mark Turco and Dr. Wang for your presentation this morning. I want to thank everybody, all of our panelists and speakers. Hopefully you got the sense that our Philadelphia MedTech community is doing some incredible things, not just that touch the lives of individuals in this region, but beyond and globally. And we look forward to future developments that come out of all of our labs, both the entrepreneurs, the big companies, the academic centers that are presented here today, and others in our community. Again, thank you and shout out to our sponsors and supporters, Duane Morris, EisnerAmper, Fox Rothschild, the Penn Center for Innovation, and RSM.